Hello, everyone, and welcome to today's panel on investing in mental health. I'm Amruta Byatnal. I'm an associate editor at Devex, and I'm really pleased to be having this conversation today with an esteemed panel of guests. Before we move to the panel, though, I would like to introduce what we're talking about today. You know, the pandemic has really shown a light, a focus in a sense on how important all kinds of health is, and especially mental health. And these conversations have been happening in recent years, but unfortunately, the investment and the funding hasn't matched the level of attention that it has received in the public domain. We'll be discussing various aspects of that. We will shortly be introducing our panelists, but before we do that, I'd like to have a conversation with Charlene Sunkel, who is the CEO of the Global Mental Health Peer Network. Hi, Charlene. It's really nice to be speaking to you today.
Thank you so much for this discussion on this important topic.
It's nice to have you here, Charlene. You know, we've been talking about a lot, you know, in the public sphere about how important it is to actually address the people that the funding goes to and the programs are designed for. So can you tell us a little bit about your own story and why having accessible and quality services is so critical for people who are actually, you know, living with mental health issues?
Yes, thank you so much. Yes, my own journey started in 1991 when I was diagnosed with schizophrenia. And I ended up 4 years being hospitalized and eventually being unemployed as a result. And apart from the costly inpatient care and medication, I found very little access to community-based services or support to help me get my life back. One of the biggest barriers I faced was stigma and discrimination. And at the time was great difficulty and a lot of determination. I managed to navigate myself through the broken system to find a place in my journey where I could explore and develop my own potential and thrive despite my diagnosis. This is ultimately the end goal for everyone that we want to achieve. But if I look back in the past 30 years, not much has changed. What has changed is people with lived experience now standing up from all corners of the world, demanding to be heard. And the evidence and the knowledge that we have today, we know that we need to listen to people with lived experience, that we need to act and do things differently to make sure that we can give people what they need to be set on their recovery journeys, where every person are able to find the purpose and value in their life, but also can thrive. I think access and quality services is not isolated to the health sector because mental health conditions affect or impact on every part of our life. So it has to be mainstreamed across all sectors, from education, workplace, justice system, and it must be a multi-collaborative approach and well coordinated and shared investment from all of the sectors.
Right, that's so important. And then, you know, from your own experience and those of, you know, who you represent at the network, would you be able to talk a little bit more about what the actual
impact? You can take things out, it's okay. The internet things.
Sorry, Charlene, if I just like to repeat my question. You know, just going by your own lived experience, as you were saying, and that of, you know, the people that you represent in your network, can you talk about specific instances where investment in mental health really affects, you know, the way people really live their lives?
Yes, certainly. I think in the bigger picture, the socioeconomic impact is detrimental. I mean, poor investment drives unemployment rates up. It creates poor work productivity. It lowers education and skills development. And of course, all of these increase poverty and forces people to depend on social grants or the welfare system. So for me, these elements create a bigger burden on the health systems. On an individual level, a lack of investment not only deprives people of mental health and well-being, it deprives us of our basic human rights. And we cannot afford not to invest in mental health. It is really simple if you think of it, because the alternative is so much worse for not only the individual, but at country level and the world.
Yeah, what you said is so critical. And then if I can also ask you, in terms of your own experience of advocating, who are your key stakeholders and how do you go about actually spreading the word, especially when it comes to making this kind of critical case about investment in mental health?
I see everybody as a stakeholder, from professionals, policymakers, governments, researchers, community-based organizations, literally everybody. I think if we don't address these issues together and with key partners, people with lived experience, we won't achieve much. Thank you so much.
Thank you so much, Charlene, for your time today.
Thank you.
And now I'd like to move on to our panelists. I'd just like to quickly introduce the people that we'll be talking to. They're all from all over the world, which will give us a great perspective on this important topic. We have with us today Sanjay Wijesekera, who's the Director of Program Division at UNICEF. We also have with us Dr. Faisal Sultan. He's the Federal Health Minister of the Islamic Republic of Pakistan. And we're also joined by Paul Bekker, who's a Special Envoy for Mental Health and Psychosocial Support in Crises at the Ministry of Foreign Affairs at the Government of Netherlands. And lastly, we also have with us Dr. REN Minghu, who's the Assistant Director General for Health and Communicable and Non-Communicable Diseases at the World Health Organization. Welcome, everyone. It's really a pleasure to be speaking to all of you on such an important topic on such a busy day and a busy week. So I know all of you are going to be very busy, and thank you so much for your time. I'd like to start with you, Sanjay. Can you talk a little bit about why investing in mental health and psychosocial support is so important for an organization like UNICEF, and how it is important for children especially?
Thank you, Amruta, and thank you very much for having us on this panel and on this wonderful occasion. And I think this is a really great that we've convened around this issue. So the sad truth is that the efforts to confront and treat mental health problems are woefully underfunded, as Charlene has just outlined. For us at UNICEF, we've elevated mental health as a major global advocacy priority over the next 4 years. And as you mentioned also, last week, we launched our State of the World Children's Report, highlighting the prevalence of child and adolescent mental health issues and concerns, and the overwhelming need for investment and action. Many governments don't allocate enough resources to this problem, and our report finds that on average, just 2% of government health budgets are allocated to mental health globally. So there's an urgent need to scale up across all income settings. This is across low income, middle income, high income countries, as well as humanitarian context. So the point, again, that Charlene was making. And it's important because around 1 in 7 adolescents aged 10 to 19 live with a diagnosed mental disorder as defined by WHO. And half of all mental health conditions start before the age of 14. Among the top 5 causes of death for their age group. So that's more than 1 young person every 11 minutes. And in nearly every corner of the globe, in rich and poor countries, mental health conditions and the lack of holistic care and responses remain the cause of significant suffering for children and young people, and the top cause of death, disease, disability, particularly for adolescents. So the evidence is are a major preventable cause of mental illness throughout the life course. So early action is important, and particularly supporting parents and caregivers to provide responsive and nurturing caregiving at home, and promoting mental health support and services in schools. So we could prevent poor, often life also the people who care for children.
Right. Thank you so much for that overview, Sanjay. We'll definitely come back to you for more on what needs to be done in conflict and humanitarian situations. That is really, critical that we talk about it right now. But next, I'd like to go to Dr. REN. Dr. REN, as someone who's looking at the WHO, can you tell us a little more about the kind of progress that has been made in recent years? And have you really seen a shift from member states themselves, as Sanjay was just mentioning?
Well, thank you for the question, and thank you for the invitation and also opportunity to join this very important discussion together with other distinguished speakers and panelists. I think the first probably point I would like to make is when we talk about investing in mental health, as you make very clear in your question, we need to take a broad perspective of what it means. It goes beyond purely financial consideration. Investing in mental health can and should include efforts to reduce stigma and discrimination, build mental health awareness and literature, reduce inequalities in access to mental health services, enhance standards of care, promote and protect human rights, and integrate mental health into primary health care, universal health coverage, and sustainable development. It also means investing in our own mental health as individuals, family members, employees, and citizens. So financing provides one of the critical means by which these actions can be promoted and supported and sustained. And in many countries, that financing is in short supply, as we observed. Just probably, a recent result from WHO Mental Health Atlas indicates media per capita spending by the governments in lower middle income country is very low, less than 2% of total government health spending. This then leaves a great burden on families who, if they can't pay at all, end up paying the cost of health services and goods that too often impoverish. So the core objectives of universal health coverage is to protect people from such a cost. Measured against the standards of government spending, the mental health financing in low-income countries has not aggressively increased over the past few years, I said. It remains absolutely lower relative to need. And what we have seen, however, is a substantial change in the commitment of member states to move against the challenges of mental health. For example, through the inclusion of mental health as integral part of non-communicable disease, primary health care, and the universal health coverage agenda, and more recently, as a vital component of COVID-19 response and recovery. Such political commitment can be seen as a necessary precursor to increase financial commitments. We have also seen increasing interest among the member states to develop national mental health investment cases for mental health, which can better specify where the additional funding can and should go to support the country and the community.
Right. Thank you so much for that, Dr. REN. We'll definitely come back to you for more on, which are the member states that are actually doing this, where it has worked, and also maybe to look at where it hasn't worked, right? I feel like those lessons are important as well. Next, I'd like to go to Dr. Faisal Sultan. Welcome, Dr. Faisal. I'd really like to, know a little more about Pakistan's investment in mental health. And, Pakistan is right now kind of modernizing its mental health systems and really trying to integrate it in the universal health coverage. So how has that process been? And, who have you, again, like who are your stakeholders? How easy or difficult was it to really bring about that change?
Thank you. So let's start with the last bit first. Who are our stakeholders? So given our size and nature of our political system, health is a completely devolved subject. So the Federal Health Ministry is really a placeholder for regulations and coordination, but all the action, all the delivery of care, and all the financing, virtually all of it, actually happens within the provinces. So one of the most important stakeholders in the health ecosystem was to get all the provincial entities on board. And while people do a lot of lip service, but at the end of the day, it was very important to weave this in, or to weave in interventions for mental health in the package of universal health services. Now, right now, we're in the midst of kind of a two-pronged major investment in healthcare. One is through really payment by the state through an insurance program for virtually all citizens for catastrophic inpatient illness. That, of course, is completely the other end of the spectrum, but very often, at least the overwhelming sort of numbers in mental health issues would be in the ambulatory setting. So it was very important that it got woven into the 100-odd interventions that were agreed upon, costed, and sort of harmonized and homogenized across all the provincial entities with the federal government to agree on a package. So now that's done, and we were one of the earlier ones to get into that. The million or $100 million question really is how one puts it into action. Now, in our case, we think that there's going to be two things. One, of course, is that use of the telecom sector. Now, the system really responded to the COVID-19 needs through the thick of some of the so-called restrictions, lockdowns, whatever. And so a number of private providers actually stepped forth to provide care, and a lot of that care had to do with challenges in the domain of mental health. So the system is primed already, and I think can be utilized. Now, that's for the private sector, but for the public sector institutions, the existing brick and mortar network, or what are called the basic health unit, these are essentially small ambulatory units all across the country, in the literally thousands and thousands of them, and this has to be leveraged to provide coverage for across the board as a universal health package for mental health issues. The other investment that has to be made, and I think the previous speaker referred to it, is beyond just money and beyond just the idea of allocating monetary resource. That's very, very important. But the issue has been that in many domains, there has been a lack of regulation or regulatory oversight. So for psychiatrists, the Pakistan Medical Dental Council, erstwhile, and now the Pakistan Medical Commission, have a direct intervention into what they do for people who are medically qualified and are practicing as psychiatrists. But as you know, that's only part of the story. And so a lot of counselors, psychologists, and other mental health professionals have sort of worked in almost a green field, which in some ways is an advantage, but on the other hand, creates crises of confidence and of verifiability as to who all has the right to be able to provide some of these services. And this dovetails into issues and challenges in substance abuse. So the entire range of this matter has to be dealt with. So what we ended up doing very recently is to, and the law is still a bill, it's actually making its way through Parliament, is to actually have an allied health professionals council, and that will include a section on psychologists and counselors and mental health professionals. So this is the kind of investment we are trying to put in right now, and to sort of refocus and sharpen our focus really on what is required for making things better. Concurrently, there is a law that is being prepared. Now, laws are easy to, well, not easy to pass, but easy to pass relative to actually make them functional. But and this relates to the rights of those that may face mental health challenges of one kind or the other. And so therefore, this is another domain which will help us. And this relates to the rights of people as far as property being represented, their rights as citizens, and to enshrine them much harder than perhaps they are at the present time. So these are the kind of investments that we've tried to make and to integrate this into the main health systems. Always a challenge because there are competing requirements, and sometimes the so-called physical health issues take center stage because they are more obvious because of lack of, or relative lack of stigma, I should say. So I hope this gives you some insight into what we are up to.
Right. Thank you, Dr. Faisal. I thought that was very interesting, and you're highlighting once again about how public health is a rights issue, it's a justice issue, and I definitely like to hear more about it, and I'm sure so do our audience, so we'll definitely come back to you. Next, I'd like to go to Paul Bekker. Paul, we know that the Dutch government has been a champion of mental health and psychosocial support within the global humanitarian framework. And so I'd love to hear from you in terms of, how this focus, this highlight came about, and what does it really take to engage not just your own government, but also then kind of bring in other partners and supporters in the fold.
Well, thank you very much, Madam Moderator. Can you hear me?
I can, yes.
Well, then I'm so happy because until 30 seconds ago, I was struggling, and thanks to Jane. Honorable panelists, because I'm in an austere company, and ladies and gentlemen, and oh, yeah. Well, to begin with, I've been in this job for 1.5 years now, and I can, until this very moment, cannot fully comprehend why it took us so long. I mean, we, the whole world, to give a proper acknowledgement and appreciation for the needs. Why mental health hasn't been on our agenda much earlier. Thanks to our Minister Secretary, she advocated actively, put it on the agenda, and now it's broadly part and parcel of a policy. We, of course, have an active civil society, even the corporate sector is involved. So, yes, it's been good to see the role of the network. We're proud of it. And actually what we've been doing, we feed into an already existing know-how like United for Global Mental Health. There's so much expertise already. So I'm happy that we can play the role that we are playing, and we encourage others to assist with us, help us do a good job. Now, to come to your question, the Netherlands believes not easy SDGs if we do not address mental health and psychosocial well-being. Why? Because we do realize that people, the conflict, disaster, fear to anxieties, which leads as a consequence. And if you add to that the fact that conflict often damages and even destroys social networks that traditionally are a countermeasure, are a sort of a safety net to deal with anxieties, then you see there is a problem. And we feel very much supported by evidence. We, I mean, the whole global community, because evidence shows that psychosocial support strengthens resilience, strengthens recovery. It fosters reconciliation on both the individual and the community level. And I'm always struck by the strong evidence that if you allow people, communities, to deal with their bereavements, with traumas, that they recover twice as fast. And I'm not even speaking too much about COVID-19. COVID-19 has dramatically increased needs, but also that's a silver lining of the cloud of COVID-19. It created a lot of awareness, but basically it has dramatically increased in needs, and we need focused efforts on MHPSS to give a good response to COVID-19. Again, conclusion for me is of the Dutch policy that if we are unable to reach the SDGs if we do not address mental health and psychosocial well-being. Thank you.
Thank you so much for that, Paul. I'd like to hear more about how exactly that shift came into being. Like you said, you do acknowledge that it was a little late, but we're in the sort of critical time that we're living in right now. I feel like these investments are even more necessary. For my next question, I'd like to go back to Sanjay. Sanjay, we're talking about, the sort of key investments that need to be made. So I'd really like to hear from you in terms of where will UNICEF be prioritizing its investment going forward? And, what is the greatest impact that you've seen as you work with national governments and even organizations such as the World Bank in terms of really spurring those investments?
Thank you again, Amruta. Our UNICEF's Mental Health Acceleration Initiative, we address gaps and build on the strengths of our programming so far, and it includes a four-pronged approach to advance mental health for children and families, and this includes implementation, data and research, workforce development, and so on. So as set out in the State of the World Children's Report that we just launched, we've identified the following priority areas.
Mm-hmm.
Psychosocial support services across all sectors. So it's not obviously just through the health system, which is really important, but also to support a more whole of society approach to mental health prevention, promotion, and care. So across the education platform, social welfare, and again, as I mentioned, parents and caregivers. The second is integrating and scaling up evidence-based interventions, and again, specifically parenting programs that promote responsive, nurturing caregiving. Mental health for quality mental health services for all, so who need them. And then thirdly, changing the public conversation on mental health. So the kind of work that outside of high-income countries, there are fewer than 0.1 child and adolescent mental health professionals per 100,000. And particularly the workforce is really important, and the cost of inaction arising from human mental health conditions in children. It's just in children itself. So huge costs, huge need to invest, and these are kind of some of the areas where we would we will be putting more effort, and obviously working together with governments and other partners.
Right. Thank you so much for that, Sanjay. Working with partners is obviously an important part of the whole process of getting mental health the attention that it deserves. And so I'd like to come back to Dr. Faisal Sultan. I'd like to know, the different kind of partners, international partners that you're working with, and also the kind of support that you think the international community can give the program going forward. And I'd also like to know, what are the lessons that you'd like to share, again, for this international community that is both trying to learn from you and also trying to be involved in this process?
So, right, I think the simple idea of investment into it for a return that is many times is self-evident. I don't think there is the need for too much science on it beyond what we know already, but one can always bolster the case for in local environments. So I think we really do think that healthcare financing is, as I mentioned, one of the investments, major investments that the government is doing. And virtually all the provincial governments have also gotten into the act. This was started with one province, the KPK, but it's been followed by, so others have followed suit essentially. And as far as the international community is concerned, I think from the donor perspective or partner perspective, it is important that the UHC package is looked at in a favorable way, because it really impacts in areas where very small interventions, very cheap interventions, all costed out down to the cents and dollars, are in there, which impact on change into the society as a whole. Now, we do understand that at many times in political environments, very often the consumer may not immediately latch on to the value of what appear to be sometimes small and perhaps not so visibly useful services that are being provided. But when looked at holistically, it really, those are the ones that matter, instead of trying to pay 50 to 100 times when the sort of the horse has left the barn. So I think these changes are doable, and there are models which are sustainable, which can be taken into account. In fact, just so happens, just tomorrow I'm going off to kick off one of such small pilots out in Islamabad. Now, there is always a hunger and need that does exist for it, but we also need to keep in mind some contextualization, some adjustment to what might be important and doable and sustainable locally. I think as I said earlier, many resources do exist. A lot of brick and mortar exists that doesn't really need to be redone in any way. You just need to align what you have and perhaps add a little bit more to make sure that you are able to provide services where they are needed. I think that we are, for us, we've been trying to redo how we deliver healthcare in this country. And as I mentioned, while this is not directly relevant to our present conversation, but it dovetails into it, is the massive injection of cash that's going to occur in 2022 into paying for every citizen's healthcare in the inpatient setting. But the direct investment into paying for services that are being provided by a third party, whether a public sector infrastructure or through existing or new private sector infrastructure, would spark an investment into healthcare delivery that we haven't seen so far. But that'll offer a great opportunity for making sure that any investment that comes in, either by the government or through any investment or any development partners, can go directly into making sure that the care needs are being met as identified. So it's a bit long-winded, but what it means really is that there is appetite in the system, and there are some delivery mechanisms, not perfect, but that need to be built. But perhaps some will be built as we sort of fly the proverbial plane. We'll have to sort of build it up as we take it up. Thank you.
Right. Thank you so much for that, Dr. Faisal. It was really interesting to me that, there are points that you think are working, and there are points that are still evolving, right? And I guess that is something that you will be working with the people themselves on the ground to also figure out what is really needed, and like you said, what is needed and what's actionable. So we'll definitely wait to hear for more on that. Next, I'd like to go back to Paul. Paul, we are at the IFC and World Bank annual meetings. So I'd like to hear from you a little more in terms of what do you think the World Bank needs to do? What role specifically can it play in the future of investment in mental health, whether it is through the GFF or the IDA or other such mechanisms?
Yeah, thank you, Amruta. I think the bank as well as the GFF can both play a crucial role in increasing finance for MHPSS, because while awareness is major, big finance is still a big issue. And how? It's quite simple. In my and help countries develop and secure funding for MHPSS investment cases, as actually is currently happening in developing such work and relationship with governments. This is actually a double-edged sword, because you help people in need. At the same time, you increase the impact of other investments, and I'm talking about investments in education or strengthening social networks. And from a more slightly philosophical point of view, I would like to say something about peace building. Peace building starts with forgiveness. It starts with acknowledgement of each other's pain, each other's hurt. Reminds me a long time ago, the Truth and Reconciliation Committee in South Africa. I was then posted there. What you need to do with peace building starts with allowing people to deal with their traumas, and that's a difficult process, a painful process. But it allows, and that's important, it allows peace building to be much more successful. So you're more successful if you go through the process. Now, if you see that, if you follow this, then allocate building to psychosocial support. But if you follow that concept, that means there would be a relatively large sum of money available.
I'm sorry, Paul, I lost you there towards the end. Can you just repeat the last bit?
Oh, I don't know. So what did you hear? Where did I stop? I made a plea about peace building, the philosophy. Okay. Right. So what my point would be, if you follow that philosophy, that if you acknowledge that peace building is more successful if you go through the process of forgiveness, of acknowledgement of each other's pain, then you would derive from that the conclusion that you should allocate funds for peace building, but specifically earmark them or allocate them for psychosocial support. Mm-hmm. That right. is the logical reasoning, and I hope others will follow this, because that would mean that a financial gap will be addressed. Is it? Can you? Because much. Okay, if you want me to. No. What have? Okay. You lost me again.
Just towards the end, but we can come back to you. Thank you so much for that. Next, I'd like to go to Dr. Ren. We're sort of talking about both the international support that is needed, but also, what is needed at a country level. So Dr. Ren, how does the WHO plan to work with the member states and the international partners to really, increase that investment in mental health and psychosocial support? And can you talk to us a little bit about, what you see as a success story, as you were saying earlier?
Thank you, Amruta, for your question again. We think moving forward, a fair and more sustainable financing for mental health should start at the home. So WHO advises and works with many countries to reformulate their health financing policies and essential package of care in line with universal health coverage principles and evidence available. For instance, the UHC components of intervention has been developed, and also the menu of cost-effective interventions for mental health. The goal here is to aggressively realization of universal health coverage, covering both wide access to quality services and also enhanced financial protection. The current pandemic has severely disrupted mental health services, access and provision. So while at the same time, it is also intensifies the demand for services that we hear from other speakers. So the very visible gaps between what is needed and what is available, plus the current momentums of interest in mental health, provides the standout opportunity to bring about the change to often fragile and ill-equipped mental health services and system. So WHO's work in this context has been to support implementation of commitment that member states has themselves made to incorporate mental health and psychosocial support into COVID-19 response and recovery plans. For example, by indicating concrete MHPSS activities within the country's global humanitarian response plans or central emergency response fund application. Sue is co-chairing of interagency standing committee working groups on MHPSS. WHO also helps to coordinate Dutch search support and HPSS programs, which of course are grateful for the Dutch government commitment support, which also rapidly deploys MHPSS experts to support the multi-sectors coordination and interagencies capacity building in humanitarian context. The further mechanism through WHO seeks to increase investment, while the newly announced multi-donor catalyst fund for NCD and mental health. WHO is very delighted to join with World Bank, UNDP, and UNICEF and UNFPA in this initiative, which aims to mobilize at least $200 million for disbursements over 5 years to support up to 25 lower and lower middle income countries in accelerating country level actions towards achieving SDG target 3.4. And however, it is important to make point here that is this catalyst fund is not a new multi-donor, multi-billion donor financing mechanism that is act as a kind of global fund for NCD mental health. Rather, it is a complementary and a targeted mechanism that can be added to ongoing efforts to better include mental health condition and other NCDs within existing instruments, such as Global Financing Facility. WHO is also working with Global Fund to fight HTB and malaria to seek the board agreement, inclusion of mental health into the newly developing Global Fund's 2023 to 2028 strategy. So my last point is resources spent on mental health should not be seen as a burdensome cost. They are truly investments that can generate returns to the economy and improve the efficiency, which health systems resources are spent, as well as provides much needed support and care to millions of people in need. As is discussed today at WHO's Mental Health Forum today, it is time to invest in better health systems, and we need to do more and better to improve mental health care. Over, thank you very much.
Thank you so much for that, Dr. Ren. As you quite succinctly pointed out, it's not burden. This investment is not a burden, and it will really kind of spur the economy. So thank you for that. We will now go to audience questions, and I'll come back to the panel for last comments right after this audience question round. So one of the interesting questions that we've got today is that the member asks, mental health is a very complex subject due to its connection and direct and indirect connections to other social causes. So how do the panelists see the role of other sectors outside of the health sector in investing in mental health? And I think that's a really important question. Would anyone like to take this, or I can point out as well? Dr. REN, actually, would you like to take that? I think that kind of, connects to what you were just saying in terms of, really bringing all the stakeholders together.
Certainly, I'm happy to start with my reflection. As we understand, no health without mental health, and mental health is associated with every social aspect we call social determinants of health, and also including mental health. That's why we understand. So including when we talk about non-health, I think it's a very broad range of what I mean non-health sector is supposed to be engaged. A lot of example, depending on the country's context. For instance, when we talk stigma discrimination, it's really about how exactly law and adjustments and systems in the country. And when we talk about public awareness, it's really about how exactly education and public awareness and communications and the medias can be absolutely on the board, working with health professionals to make sure what exactly means when mental health, and to mitigate the risk and discrimination and stigma. And when we're also talking about how exactly mental health can be integrated with humanitarian crisis response, with natural disaster response, that's also, should involve in many sort of sectors which can completely beyond the health sectors. For instance, emergency to natural disaster response, this might be the other departments in the government settings who are supposed to be leading this role. So I think that's exactly why when we talk in mental health, we look at how the country context, which government agency is supposed to be leading, which is areas in collaboration and working with health sector. And WHO and other all UN agency, we are absolutely working in the same family, are ready to work with all our country counterparts to make sure mental health can be included into every social determinants of health issues. So that's exactly the future direction, how exactly and why we should work together.
Right. Thank you so much for that, Dr. REN. Paul, I see your hand is raised. Would you like to respond to that question?
Yes, thank you. Yes, actually adding to what Dr. REN was mentioning, I just want to share an observation. I've been in Geneva now since a few weeks, which is a new position. I'm very honored to be the new permanent representative of the Netherlands. And what I've seen is how much theory turns into reality. We always say, yeah, people should practice what they preach. Well, that's exactly what I have been observing. MHPSS is really internalized in the discourse of international organization. I can see it's part and parcel of their thinking, of their policy making. Last week, I listened to High Commissioner Grandi at the Executive Committee, and he was clearly speaking from the heart about MHPSS. And of course, we know that Director General Tedros from WHO really speaks often and about MHPSS, and it is a priority of those organizations. So listening to Dr. REN, and when we talk about other sectors, because that was a question, that's what I just wanted to share, because I was really, really encouraged by this recent observation. Thank you.
Thank you so much for that, Paul. Sanjay, I see your hand raised. Would you also like to respond?
Yes, please, Amruta. Just briefly reinforcing what Dr. Minghui and Mr. Bekker just mentioned. I think it's important to look at the whole mental health continuum and prioritizing also prevention and promotion, and that's where particularly the role of other sectors such as the education platforms and the experience through the school system, social welfare, social protection, all these things become very clear, and obviously complementing the really important role that the health sector plays. And so this is why kind of when we look at investment, we have to look at it holistically. Obviously important to have health sector budgets where they are, but also important how we use the funding across the other platforms as well, and the other touch points that affect the lives of children, caregivers, communities.
Right. I seem to have lost Sanjay there for a minute. We'll definitely come back to him. We have one more question, in this audience round, which again is open. So, I'd like to kind of open it up to the panel. Charlene, who is also here with us, if you'd like to respond to this, I think the audience would love to hear from you. And the question is, when the decision is being made to identify priority areas for allocation of funds by the World Bank and the international donors, how involved are the beneficiaries themselves? Again, people with lived experience, as Charlene reminded us, in this process, if at all, and what does that kind of engagement look like?
Yeah, I think for me, what I see there's greater inclusion and especially recognition of the involvement of people with lived experience. But I think we also need to recognize that it must also go together with empowerment of people with lived experience to make sure that they are able to meaningfully and authentically be included in decision-making processes. And I think what's always important is not to just from the get-go to include people with lived experience right from there. I think we provide a unique perspective, especially in terms of systems, because making use of systems almost on a daily basis, we can add tremendous value in terms of that.
Right. Thank you for your insight, Charlene. Sanjay, would you like to answer that as well? I'm also interested sort of in the humanitarian conflict situations. How are these decisions made? At what level are people who are affected also involved in the decision-making process?
Important for all of us, and particularly government service providers, to listen to people with lived experience of poor mental health, as well as to young people, to ensure that the valuable experience and perspective and psychosocial well-being are critical to the basic functioning of societies, as Mr. Bekker also pointed out, and the recovery from emergencies, conflicts, protracted crises, pandemics, as we have seen, other adversities affect the mental health and psychosocial well-being of children and their families. So these are big stresses on them, and without the adequate support, these experiences then have huge impacts on the well-being of individuals.
Right, exactly. Thank you for that, Sanjay. We have a related question, and this might be our last question for the day. So we have a panelist from Uganda who says, mental health financing is directed towards institutionalized care, but yet, they're also epicenters of the COVID-19 pandemic transmission, right? So how do you ensure that increased investment for the sake of it not only reduces the investment gap, but also addresses the real need? And he says, how will the panelists ensure that the real investment to us means increased investment, and especially at the community mental health services level? I'd really like to hear from Dr. Faisal on this, because like he said, he's sort of in the middle of a rehaul, so to speak, in Pakistan. So how are you, Dr. Faisal, really ensuring that communities' needs are really taken care of?
Right. I think in a way it relates to what's been asked earlier, which is how do we actually fully weave in the asks and needs of those that we wish to serve. And how we do that and how it gets prioritized and how it actually gets served. One of the things that we've done recently, which was somewhat difficult to do, but we managed this, which was to actually create a national mental health task force with representation from a very broad array of people and stakeholders, including those that are actually working in the field and have a hands-on knowledge and understanding of what is required. And to have this headed by the president. In Pakistan, as you perhaps realize, the president's office is ceremonial. It is the executive office is that of the prime minister. But our current president is a dentist by profession and very hands-on in his passions. So he's taken this on almost as a personal venture. And what we've tried to do is create the next framework based on input and advice from indeed the very people that we wish to serve. So that's been one way, but that's just at a very strategic level. At the operational level, the key challenge would be to ensure that our healthcare delivery system does not discriminate. To me, I think if we are able to do that, then at least we have half a chance of getting the help in a way that is required rather than in a way which we might have notions of as providers. This is is a common disconnect in many care and provider situations, but especially so in things where there is stigma. I know as an infectious diseases physician, I deal with this for HIV, and it's very similarly, it is for mental health challenges. I hope I've answered your question.
Right. Thank you so much for that, Dr. Faisal. Unfortunately, with this, we've reached the end of our time here for our panel. I'd like to thank all our panelists again. Thank you also to Charlene for really sharing critical insights here. I'd encourage all of you to keep the conversation going on social media, offline as well. Thanks for our audience for really asking those important questions and for listening to us today. Thank you, and I'll talk to you soon.
Thank you. Bye-bye.
Thank you. All right.